All right, Tammy, go ahead and walk towards me at your normal pace. Great job. Go ahead and turn around and go back. Perfect. And then again. Back, yep. Any issues with normal walking right now that you're noticing, or?
Just a little pain on my right ankle.
Okay. Okay, this time I want you to walk just a little bit faster. So ready, go. A little quicker, good, really push off. Like you're trying to get somewhere quickly. Good, and then one more time, really quick, good. And then all the way back, good, and then when you get back there, just stop.
This hurts my knee a little bit.
When you sped it up, it hurt a little bit more?
Yeah.
Okay. All right, now this time what I want you to do is you're going to walk with long, exaggerated strides. So you're really gonna take a long, exaggerated step. Great job, good. And then turn around and go back. Good, what do you feel when you do that? Anything when the left leg is behind or in front? Do you notice any kind of sharp?
Just a little bit of that same, like right there.
Okay. When it's in front of your gait or behind?
In front.
In front, okay. All right, so now this time what I want you to do is you're gonna externally rotate, you're gonna turn your toes out as far as you can. First, anything with just holding that position that you notice?
Just really tight in my right hip.
Okay. All right, so if you're toeing out as much as you can, you're gonna walk, good. So still feeling the right hip, anything in your left knee or no?
Nope.
Okay, good, and then turn around and go back. Okay, great. Okay, now this time you're gonna do the opposite, you're gonna toe in, so just standing there, do you have an awareness of anything that you feel? Just that right hip, okay. The left knee is fine?
A little bit on the
Okay. More than going out. This one feels a little bit more on the left knee going in and out.
Yeah, but it's gone now.
Okay. Okay, cool. Okay, great. Okay, now this time, can you kind of squat down a little if you can, and you're gonna try to do a little squat walk if possible. Okay, great. Good. And turn around and go back. Anything you notice, any awareness there in your ankle or your knee or hip?
It just hurts like this right here.
Okay. All right, so now for the next test, what I'd like you to do is you're going to, can you do a air squat? Can you scoot a little bit closer to me? Yeah, right there is probably good. And then however you normally put your feet, just do a regular squat, maybe do like 3 or 4 in a row. Go down as far as you feel comfortable. Okay, great. Any awareness there with anything particular?
Same, just a little, like on the initiation.
Okay.
When I'm like at 90, I feel fine.
Okay, so like when you first start and go down, like there?
Yeah, right there.
Okay. But then you get through it?
If I'm here, I'm like totally fine.
Okay. And then what about on the return on the way up?
I feel it just kind of like, almost like clunk back over.
Okay. All right, now what I'd like you to do is, can you do a squat with your feet a little more narrow?
Yeah, actually kind of like that better.
Okay. Not as bad, huh? Not on the initiation either? You don't feel as much that first few degrees?
It's like slight.
Okay. Okay, now you'll do the opposite. You're gonna go wide. Still feet, fairly straightforward, but wider.
I just feel my right hip.
Okay.
Like if I give myself a little bit, I feel fine.
And what about your left knee? Anything on the initiation, like the regular?
No, it feels better on the initiation. When I come back, it's that same like little clunk over.
Okay. And then now what I'd like you to do is, what if you just go kind of regular, but toe your feet out more? See if you give yourself a little more room in your hip and ankle.
I don't like that.
Where do you feel that?
My knee.
Okay.
And then my hip.
So really pretty uncomfortable. Okay. All right. And then what about if you just toe in slightly? And you don't have to go down very far, but just having awareness or noticing if that does anything.
Just a little bit on the lateral aspect, but not bad.
Okay. All right. So it seems like
it feels better on my hip.
Okay. So regular, and then definitely when it was wide and toed out, you didn't like that at all. Okay, so now for the next thing I want you to do is you're gonna do a forward lunge.
You want me to go this way?
I want you to do both. So maybe do it at me first. Good. And then come back. Do maybe, how about 3 on each side? Anything with that left leg behind or that you notice in your knee? Anything?
If I keep it real straight, then no, it's okay.
Okay.
I don't really like that.
Okay. And then what if you just?
I like to like walk. It feels better if I do walking
Okay.
rather than like in and out.
What if you don't go as far? Does that do anything?
It's still just that like same
Okay.
like sharp kind of pain under there.
And then when it was behind, when you tightened it, it was not as bad.
Yeah, and like that, I don't really like.
Okay, like a static
Yeah.
one. And then let's go lateral now. So yeah, we'll go lateral lunge. Good. Anything on your left knee first of all when you go that way or no?
No, it feels pretty good.
Okay. Anything particular there?
No.
Okay, good. Okay, now will you turn sideways
Okay.
and then do your forward lunge again? There you go. And then the other leg, if you can.
It just
Yeah, it seems like when you push off, especially.
yeah, it's like that like jolty feeling.
What about when you don't have to do it again, but going down into it, not?
Yeah, I don't really like that like initial like the weight acceptance
Okay.
hurts like under my patella.
Okay.
I do feel like if I had shoes on,
Oh,
I could probably do it a little better, but on the tile,
okay. It hurts.
just I don't know, probably just don't want to like slam my
Yeah.
foot in. So
Okay. Doing great. Okay, so now what I want you to do is can you balance on let's do your right leg first. So put all your weight on your right leg and then lift your left knee up really high, as high as you feel like you can. Just sit there for a second. Okay, so now what I'd like you to do is you're gonna, stand up on there and then you're gonna you're gonna turn your hip out to the left-hand side. And then kind of come back, great, and do it again.
I'm
Good.
pretty hard on my ankle. So
Kind of feel it like compressed or tight.
yeah, I just kind of get that like pain on that lateral aspect.
Okay.
It just feels hard. Like versus this side feels a lot easier.
Okay. You think you can try? Do you feel safe doing that on that side?
I mean,
All
this side I feel like actually way
right. Okay.
better on.
And because your knee's not bent, it doesn't. For the most part, it doesn't hurt your knee.
No, yeah, I'm fine. Like straight like deadlifts, those kind of things. Like even like
Okay.
lateral RDL, like none of that really hurts.
Perfect. So it sounds like when you don't really
When
bend
I
your
don't
knee,
bend it, I'm good.
it's better. Okay.
Or
All right.
like non-weight bearing bending, full weight bearing is usually
Okay.
like a bridge. I don't really feel it. So
Okay. Let's just try this. Can you get in a plank? And then
like a tall one.
let's just go hands and feet. Yeah, tall. What about just if you were to go from there to just bend your knee up? We'll alternate. So you have all your weight on one side. Just bring your knee.
I don't really love that like
Okay. Just
initial bending.
and then what about
I
just
can do this.
yeah to your knee? Yeah,
That's fine.
that's good. Okay.
Yeah, but like to unhinge.
Unhinge it. Okay.
is-
All right, that's good. It gives us some ideas on what to
Yeah.
do therapeutic wise. All right, let's try box. So let's do a couple step ups if you can on both sides. How's that feel? Looks good.
Fine. Yeah.
Anything particular there?
It's just like hard. I feel like that initial, like I don't feel like I can actually weight bear and get up.
Okay.
I have to
Hard,
kinda,
like it's hard.
Yeah, it's hard.
It's not necessarily sharp.
Right. And
Maybe-
then
And then down, yeah.
like here, I can do that fine on that side, but like I don't even wanna. Like that hurts really bad.
Okay. Yeah, so it definitely seems like the first initial degrees.
Yeah.
Okay, what about a lateral step up? Sideways, then the camera can see it this way. Good.
Kind of hurts. Like that.
Okay.
Again, that like initial.
Is it about the same as forward or a little worse? Or the
Worse.
same? Okay. Forward seemed a little bit better. That one's good.
Yeah, just grindy, a little grindy, but
Okay, all right, perfect.
Good.
Anything else you feel like you need to show me that would help me guide the treatment? Okay, great.